I just want to keep the spotlight on Delhi for just a little while longer because, the national capital is now proving to be a major challenge as far as the COVID pandemic is concerned. First of all, take a look at these numbers, which are the active cases in Delhi. November 1st, 34,173. November 5th, it went up to 38,729. November 12th, 43,116. And when it comes to November 24th, it has gone down to 38,501. But the most worrying factor for people of Delhi right now is the number of deaths. And I will take you back to October 24th, a month, back, when the number of deaths in Delhi had come down to 36. Since then, take a look at how they have increased. November 1st, it went up to 51. November 10th, 83. And then just to take a look at the progression. November 18, 131. November 21, 111. And on November 24, 109 deaths. We are talking about people. I mean, these numbers don't actually tell you the entirety, because we are talking about individuals, those who have lost their lives because of the coronavirus. Now, as Delhi continues to battle the coronavirus pandemic, the city reported more than 6,000 fresh cases in the last 24 hours, taking the total active tally to 38,501. But it's just, as I've been repeating, the number of deaths, that is something that is the biggest worrying factor as far as Delhiites are concerned. I just very quickly, a lot of experts are saying that lockdown is not any sort of mechanism or a solution, but did Delhi unlock rather quickly than all the other states? That is something that now is being debated, is being spoken about. So we'll just take a look at how the timeline of how Delhi opened up, because it quickly opened up and fast and largely opened up quicker than other states. June 8th, state borders were reopened. Religious places, malls were allowed to open on July 8th. August 1st, hotels, street hawkers were permitted. September 12th, Delhi Metro was fully functional. 13th, gym, yoga centers were allowed. And October 7th, weekly markets were reopened. October 15th, cinema halls were opened as well. Yesterday, I had spoken to the Deputy Chief Minister of Delhi, Manish Sisodia. And I asked him, is there any rethinking as far as the lockdown is concerned? Is Delhi going to go under another lockdown? Well, he categorically denied that any lockdown is on the cards, saying that is not the solution. But the fact is, ladies and gentlemen, Delhi, not just because of the festivities, but also coupled with the pollution problem, is facing a major challenge as far as the COVID-19 is concerned. And this has made the situation for Delhiites, those who are now traveling across the country for work, much, much difficult. Now, imagine if you are traveling from Delhi to Noida for your work, or to Gurgaon, or to Ghaziabad, or to Faridabad. There is now a problem. Random testing has started because all these satellite towns are worried of a big inflow of the people from Delhi, those who could potentially bring coronavirus to these cities. Apart from that, even in Mumbai, now there are restrictions which have been put. If you are traveling or flying in from Mumbai, you will have to get an RT-PCR test report, which is just 72 hours, just before landing in Mumbai. 72 hours before that, you will have to get an RT-PCR negative test. In Maharashtra, if the passengers from Delhi they will have to go the RT-PCR test. Those not carrying the COVID test will have to undergo compulsory RT-PCR tests on arrival. Train passengers entering Maharashtra from Delhi will also have to carry a negative RT-PCR report. Those travelling by road shall be tested for symptoms including body temperature. Passengers with symptoms will be made to go antigen tests. Now, this has in fact created a lot of problem and confusion for the people. Take a look at these reports filed by my colleague Pankaj Upadhyay.
The new travel guidelines apply for the train passengers as well. For all those people from Delhi, Rajasthan, Gujarat and Goa travelling towards Mumbai and Maharashtra, they need to have RT-PCR negative test report with them. If not, then on arrival, they will undergo screening tests. Post that, if symptoms are found, an antigen test will be conducted, and if the report is positive, then such passengers will not be allowed to go home, which clearly means, to be on the safer side, passengers should ensure that before boarding, the sample collection should be done 96 hours prior, and if they have a COVID-19 RT-PCR negative test report, then they can travel safely to any part of Maharashtra. As far as the railway administration is concerned, it maintains that all its facilities are in place and it is absolutely ready for the screening of the passengers. With camera person Mahesh More, this is Pankaj Upadhyay in Mumbai, reporting for India Today. The new domestic air travel policy comes into effect from today, that is 25th November. Now, the various standard operating procedures that have been laid out by the government of Maharashtra will be in addition to the various SOPs already existing at the Mumbai airport and the various airports across Maharashtra. Passengers arriving from Delhi, Rajasthan, Gujarat and Goa will mandatorily need to have negative RT-PCR report when they arrive at the Mumbai International Airport or various airports across Maharashtra. Those who do not get their test reports will have to mandatorily undergo RT-PCR tests at the various arriving airports across Maharashtra. As far as the civic body in Mumbai is concerned and the state government is concerned, it maintains that the next 3 to 4 weeks are absolutely critical, and seeing the rising COVID cases in various northern part of the country, the government believes that it is time that a strict vigil is kept at the various airports across Maharashtra. With camera person Mahesh More, this is Pankaj Upadhyay in Mumbai.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.